Hello and welcome. We are so glad that you are here to find out more about how to provide the best care for those you serve who are experiencing memory issues. My name is Mary Catherine Lundquist, and I work at the COPSA Institute for Alzheimer's Disease and Related Disorders at Rutgers University. For the past 46 years, we have been providing care for those with memory issues and their caregivers. Your job in Adult Day is so very, very important. It takes a special person to care for those with memory loss. Know that you make a profound difference every single day. We hope the information shared in this video helps you have a better day at work. This is the first video in a 7-part series based on the Foundations workbook designed for you, staff in Adult Day Centers. You can download the workbook for free from our website. Let's start with an overview of dementia. Stop and think for a minute about some ways you may have heard people describe memory issues in the elderly. Maybe you've heard some of these terms like senile, second childhood, or some people even say old-timers disease. When I was growing up, people used to talk about hardening of the arteries. The correct term we use today to describe memory loss is dementia. Let's take a closer look. Dementia is a broad term. It means memory loss that causes impairment in brain functioning. It's very important for us to remember that although we may all get a bit slower as we get older, it is not normal to have significant problems with memory as we age. Also, there are many diseases that cause dementia. The diseases we are going to talk about are not present at birth, but develop later in life. They are progressive, which means that as time goes on, the person will get worse, and they are irreversible. There are no current cures. We can think of dementia like an umbrella. In addition to Alzheimer's disease, there are other diseases that also fall under this umbrella and cause memory loss. Lewy body disease and Pick's disease are other illnesses that impact the brain and cause changes with thinking, mood, and behaviors. Some people with Parkinson's disease may develop issues with their memory in the later stages of their illness. There is also vascular dementia, which occurs when a person has a stroke or experiences loss of blood flow to the brain. Although many of these dementias have things in common, there are also differences. Understanding the similarities and the differences helps us provide better care for those with dementia. For instance, Alzheimer's disease can come on slowly, so family members may not even notice at first. A vascular dementia may start suddenly when someone experiences a stroke. Pick's disease can progress rapidly, so knowing this can help professional and family caregivers better plan. It is important to see a professional who can diagnose the cause of memory loss. Things that are considered when making a diagnosis are a thorough physical exam, review of blood work. A brain scan can be very helpful, such as an MRI or a CAT scan, a psychiatric evaluation, and also neuropsychological testing can be helpful. A person can visit a geriatric assessment center to get this type of workup. They may also see a geriatrician or a neurologist as well. The most common disease causing memory issues is Alzheimer's disease. It starts slowly and progresses gradually. It brings chemical changes in the brain that starts to kill off the brain cells. It causes short and also long-term memory loss. There is the loss of language. People will have difficulty finding words when they speak and also have difficulty understanding what others are saying to them. They may also have a hard time focusing and may be very easily distracted. Vascular dementia is another disease that causes memory loss. When a person experiences loss of blood flow to the brain, they are experiencing vascular dementia. The most common thing we hear is when a person has a stroke. That's a larger episode where there's loss of blood flow to the brain and the person has a stroke. Now, vascular dementia can come on gradually, but lots of times it comes on very sudden. A person, in addition to having a large stroke where we can see some type of impairment, like they can't speak for a while or they can't walk, they lose motor ability on one side of their body. We might see that with a stroke. A person may also have a series of small strokes called TIAs or trans ischemic attacks that we might not even be aware that they are having. This type of dementia is caused by impaired blood flow to the brain. A person who is experiencing vascular dementia may have personality changes. Maybe they were calm before and now they're very irritable. A person who has vascular dementia may also be prone to experience depression. They may feel sad and blue often. They will have memory problems, most noted short-term memory problems. We may tell them something and 5 minutes later they're asking the same question again. Vascular dementia can be a step-like progression. That means that a person can be fine for a while, maybe a few months or even a few years, and then they have another vascular episode like a stroke or some TIAs, and their functioning all of a sudden declines. And then they can plateau again for a few more months or even a few more years. The difference with Alzheimer's disease is that it's more a slow, steady progression like a slope going down. The vascular dementia can be more of a step-like progression. Another type of dementia is called frontal temporal lobe dementia. Now, when someone has Alzheimer's disease, they're going to have certain chemicals in the brain that are going to start to impact and cause brain cells to die. Frontal temporal lobe, similar, there will be chemical changes that are going to start to happen in the brain. They're a bit different from Alzheimer's disease, and they're more concentrated in the front part of the brain. The front part of our brain is responsible for many important things. That's where our filter is. We might think something or feel something, but we don't come out and say that in public. Oftentimes, people with frontal temporal lobe dementia might start to say things in public that are inappropriate or do things in public that are inappropriate because the frontal part of their brain, where their filters are, has been impacted. Frontal temporal lobe dementia can start gradually and in middle age, so a younger onset for people. Like in Alzheimer's disease, a person with frontal temporal lobe dementia, their brain will start to shrink because of the changes that are going on in the brain. There may be personality changes, and a person may exercise poor judgment. The frontal temporal lobe dementia progression can be quick, whereas Alzheimer's can be slower. Frontal temporal lobe can be a much quicker progression. So things to remember when we think about dementia. Dementia is a syndrome. Remember our umbrella. There are many diseases that can cause dementia or the memory loss. Think about it like cancer. When a person has cancer, we want to know what type of cancer because there are all different kinds of cancer. Knowing what type of cancer can help us get the best treatment. The same thing with dementia. Knowing the cause of dementia can help us get the best treatment and can also help us best plan for the future and do things to help support a full, rich quality of life. Remember that the onset and the progression of all these dementias varies. Some might come on quickly and some can come on more gradually. It's very important for us, especially in adult day, to remember that as a person experiences these diseases, they, yes, will have deficits, things that they won't be able to do that they used to be able to do, but they will also have lots and lots of strengths. And as time goes on, a person's strengths and their deficits will also change. We're going to spend time in the videos coming up talking about how do we uncover those strengths and how do we compensate for some of those deficits. Also know that people who have dementia may also have two things going on at the same time. Many people have Alzheimer's disease and they may also have a vascular component as well. So this is very important for us to remember when we care for people who have memory loss. Thank you all for joining this session today. We hope this information has been helpful. We want to thank you for all you do in adult day programming to improve the quality of life for our friends with memory loss. We hope you can view the other 6 sessions as well. To download the workbook, please visit our website.